The House Human Services, Finance, and Policy Committee is called to order. We do have a quorum, and so Representative Gander moves the minutes from April 3rd, 2025. Are there any additions, corrections, or changes to be made to the minutes? Seeing none, all those in favor of adoption of the minutes, please signify by saying aye. Aye. Opposed, say nay. The motion is approved, and the meeting minutes from April 3rd, 2025 are adopted. First on the agenda today is Representative Noor. Representative Noor moves, Chair Noor moves House File 2995 be re-referred to the Committee on Ways and Means. Chair Noor, to your bill.
Thank you, Mr. Chair. That's my motion, that House File 2995 be re-referred to the Ways and Means. Mr. Chair and members, this is the Human Service Focus Adjustment. Every session we adjust because of the programs that we run are based on focused program, so that we can be able to pay for or collect the funds that are not spent. And I just wanted to ask if nonpartisan will like to just walk us through a little bit on the bill.
Mr. Harney.
Chair Schomacker, members of the committee, Chair Noor is correct. The plainest way to explain House File 2995 is it aligns spending in fiscal year 25 with the latest February forecast. That aligns with forecasted programs within this committee's jurisdiction, that being general assistance, Minnesota supplemental aid, housing support. This carries the Health Committee's Minnesota Care adjustment, medical assistance, and the Behavioral Health Fund. The total all appropriations spending by this bill to align with the February forecast is $137,099,000.
Chair Noor.
That's the bill, Mr. Chair and members.
All right, is there anyone in the public who wishes to testify on House File 2995? Seeing none, public testimony is closed. Questions from members? Seeing none, final word, Chair Noor.
It's a good bill. Please vote for it. Thank you.
With that, Chair Noor renews his motion that House File 2995 be re-referred to the Committee on Ways and Means. All those in favor signify by saying aye. Aye. Opposed, say nay. The motion is approved, and House File 2995 is re-referred to the Committee on Ways and Means. Next, House File 2434. I will move that House File 2434 be laid over for possible inclusion. Today, we are referring to the A1 amendment. That is the governor's revised budget after the February forecast. And with us to present on this is Director Bailey. Welcome to the committee, Director Bailey. Please state your name for the record and present the updated budget.
Thank you, Chair and members. Again, Elise Bailey, Budget Director of the Department of Human Services. And I'm just going to quickly highlight what the amendment and the revised budget has in it compared to what we had previously presented in this committee on the governor's budget. Now, of course, the amendment includes repricing of our proposals according to the February forecast. So any forecasted spending change that we had in the original budget needed to be repriced according to the different base in the February forecast. So that's a lot of the amendment before you. You also have some technical changes around moving things to the correct jurisdiction, and then adding in, frankly, missed language that we accidentally didn't include in the original bill. So all those changes align with the change pages in the governor's budget book. There are a few new proposals or different components within the governor's budget, and I'll quickly go over that. In the original budget, the governor proposed to cap the inflationary adjustments on the disability waiver rate system by 1% per year. The revised governor's budget updates that to 2% per year. And so under this bill, the inflationary adjustments would be adjusted every 2 years with a cap of 2% per year or 4% per adjustment. In the revised budget, we also have a new proposal around the medical assistance under the Tax Equity and Fiscal Responsibility Act, or TEFRA. TEFRA is a program on a federal level that allows for families who don't meet the income standard for the Medicaid program but have children that have a disability and require services under the Medicaid program to buy into the Medicaid program through fees. Under this program, parents pay a fee based on their income, as well as the level of services provided to their child. The program was repealed in the 2023 session. So this proposal reinstates those fees, only for families, though, with incomes of 675% of federal poverty guidelines or higher, and whose child has MA eligibility under this option. Excuse me. So to put this into perspective, 675% of federal poverty guideline for a family of 4, that's $217,000 a year, or for a family of 2, it's $143,000 a year. At that income level, the TEFRA fees are set at 4.5% of adjusted gross income, and then they increase to 5.99% up to 975% of federal poverty guideline. That next tier is around $313,000 a year for a family of 4, or $206,000 for a family of 2. The fees cannot be in excess of the services provided to the child, and if the family has more than one child, they cannot be in excess of the amount for the child with the highest expenditures. Moving on to the next new component within the governor's revised budget. Our original package had a proposal around housing stabilization services that added more funding to the department to increase our time in processing eligibility on the provider and person side. This revised proposal adds one additional component. This is a budget neutral change that clarifies the financial eligibility for housing stabilization services. Federal guidelines for receiving a 1915I, which is the federal approval way that we get these services approved, they require that an individual be at or below 150% of the federal poverty limit. However, Minnesota statutes allows for an individual who is pregnant to be eligible for if they're at or below 278% of federal poverty guidelines, creating a discrepancy between federal and state eligibility criteria. This proposal just aligns with the federal guidelines. We are already changing the program requirements, so it's codifying what we're already doing under current law. We also, in the original budget, had a technical proposal page, and this was the most exciting page, I'm sure, you'd want to read in the change page book. We are including 2 additional budget neutral items in this page. Last year, the legislature authorized a 1115 reentry waiver. This allows the state to pay Medicaid services for a person exiting a correctional facility. CMS requires that states with this approved 1115 reentry demonstration to provide MAT services. However, the enacting language only included a list of services that didn't specifically specify MAT, but the fiscal analysis assumed it. So this proposal just is a budget neutral proposal clarifying that MAT is included in that minimum benefit set. And then lastly, in the last legislative session, the legislature changed SUD rates in a few different ways. Certain rates, such as clinically managed low-intensive and high-intensive residential services, were codified at that time as fixed dollar amounts. However, in a separate part of statute, a 3% increase was also approved. And so this proposal just aligns with what the actual rates are in those sectors. And with that, I'll stand for questions.
Thank you, Director Bailey. Are there questions for the director on the governor's revised budget? Any questions? All right, I get a sense that people know what's going on here. I will move then adoption of the A1 amendment. All those in favor of the A1 amendment signify by saying aye. Aye. Opposed, say nay. The A1 amendment is adopted. So we just lay this over and adjourn? With that, members, Chair Noor, any comments on anything?
Thank you, Mr. Chair. I think as you can see, we do have the revised 26-27 biennium budget booklet. It's a big book that everyone will have to start reading quickly. We will be having public comment. We have published, Mr. Chair, we've already published the spreadsheet for this committee, and we will also have the DE amendment published today. So we can this afternoon, and we will have more conversation on the budget as we are going to be doing a DE on Thursday. So I think we've got a roadmap ready. We need to get ready, and anyone who wants to testify, the timeline is now. Otherwise, you can follow us online. Thank you, Mr. Chair.
Thank you, Chair Noor. With that, I will renew that House File 2434 as amended be laid over. And with that, members, we are adjourned.